Hello, this is Dr. Francois with a quick thought for the day. Today, I want to think about and talk about decision and empowerment and how we very often exposed to situations where we get given a certain outcome and a choice between point A or point B, and quite often there's actually a point C, another possibility. So, for example, when a patient gets given a certain diagnosis and they get given the facts and the data behind that, then they also get given a prognosis. In other words, how this will work out and how well they will do or not do. Now, what you have to remember is that the information the doctor is giving the patient is based on the most recent studies, is based on other people's experiences, and therefore the best the doctor can do really is to provide that which is available at that moment in time. Does that mean it's the full answer? No, it's not. And as clinicians, we know this. It basically means that even though, to the best of our knowledge, a certain situation is the truth, that doesn't necessarily mean that that is the truth. It is just to the best of our knowledge. So if a patient has, for example, cancer, and we say to the patient that this cancer is incurable and this cancer will have a certain process through which the patient has to go, and most likely the patient would die after a certain amount of time. That is a very tricky thing to do, because what you're doing is you're basing your decision, basing your information you're giving to your patient on the previous experience of other clinicians, on information available to you, and as to what your understanding is of the situation. But that is only your understanding at that moment in time. So from a doctor's point of view, I feel personally it's quite important to share that with the patient, to tell the patient, as far as I'm aware and as far as the information available to me at the moment in time would suggest, this is the outcome, this is what we can do. But that isn't necessarily the full picture, and that it might even be in a year's time, 6 months' time, 2 years' time, that we find something new that changes the whole situation completely, changes the prognosis completely. A good example of this is that we are nowadays treating conditions and healing people from conditions that only a few years ago they would die from. We are treating people now on a routine basis with antibiotics, for example, that turn of the century wasn't available. And if you went back 100 years ago, people used to die from the simplest conditions in today's terms. Appendix, for example. Appendix was a really serious thing to have about 100 years ago, whereas now we think, oh, well, that's just an appendix and we will deal with that in X, Y, and Z way. And even nowadays, when we do laparoscopic, so keyhole surgery, we can actually do so much for a patient that only a few years ago it was thought to be impossible. So my thought for the day is this: when we then either get information from a doctor or give information to a patient, to always remember that there's that small bit of knowledge that we do not have that sometimes can make all the difference. And so even though this is our current state of knowledge, even this is what we can provide for the person at this moment in time, that there's always hope, that there's always the possibility of things being different. There's always the possibility of things for that person working out in a different way, and to not take away people's hope just because our knowledge at this moment in time might be limited. That's our thought for the day. My name is Dr. Francois. All the best.